السلام عليكم ورحمة الله وبركاته. دكتور خديجة الفقيه سينيور نيورولوجي Alfaqih من KAMC. حابة أقدم الشكر الجزيل للدكتورة إيلاف على تنسيقها وعلى تجهيز الملتقى الجميل هذا، يعطيها العافية، وشكرا لجميع القائمين على هذا العمل. حاب قبل أتكلم عن موضوع النيورولوجي أحب أوضح بس معلومة بسيطة. احنا بنحاول قد ما نقدر إن نوضح لكم نبذة بسيطة عن التخصص والتخصصات اللي تكلم عليها زملائي قبل كده، لكن you have to take an elective rotation in order to see the all spectrum of the specialty by yourself. بداية موضوع النيورولوجي as specialty as in neurology Saudi program we have 5 years. 3 years R2 R1 R3 is a junior year, 4 and 5 is a senior years. طبعا في الإكزامز عندنا promotion exam، عندنا part 1 and part 2 exam، وعندنا OSCE exam. For the promotions, each year we have a promotion exam, and each year you have to take this exam in order to pass. For the part, we have part 1 and part 2. Part 1 for the junior level, either R2 or 3, and part 2 in the senior level, R4 or 5. For the OSCE exam, each year we have an OSCE exam you have to enter. Regarding the rotations, it differs from each level. Mainly during the residency training, we will have 2 just elective rotations in R5, but all the other remaining rotation will be as mandatory. In R1, you will be rotating between ER, CTU, which is general medicine, and rheumatology, endocrine, neurology, neurosurgery, ICU, cardiology, psychiatry, and ID. طبعا الفكرة كلها في R1 rotation بتختلف من سنة لسنة، فهذا آخر تحديد كان من الهيئة هذه السنة، فهذه التحديدات الجديدة اللي صارت. بالنسبة ل R2 you'll be rotating، حتكون inside in-house for the neurology department. Mainly will be rotating between consultation, inpatient, clinic, and neuroradiology. For the clinic, you'll be rotating between different specialized clinics. So epilepsy, you have stroke, you have neuromuscular, you have also stroke cases. For the R3, you will be also rotating between consultation, inpatient, clinic, other additive specialty in nerve conduction study, EMG, EEG, pediatric neurology, and research. For the R4, the same in-house rotations like consultation, inpatient, clinic, neuroradiology, nerve conduction study, and EMG for 1 month, EEG, and research. For the R5, mainly will be in-house, and most of the rotations will be in-house, including the elective rotation. طيب بالنسبة للادفانتجز for the neurology as specialty، للأمانة neurology is one of the interesting specialty. يعني usually we do not diagnose the disease and that's it. No, usually we are localizing the lesion, why this patient developed the symptoms, why it's reflecting. If the patient have, for example, image, whatever the lesion in the brain, we said why this patient has symptoms, and does this symptoms explained by the CT finder or not. The other thing, usually after we localize, we interpret the clinical and the radiological finding. But really, it's a very interesting specialty. The other thing is the brainstorming. Usually, we are thinking, localizing, lateralizing, looking for the etiology by itself. We do not just diagnose the disease, as I mentioned before. And mainly, it's clinical-based specialty. Usually, we depend on the diagnosis for the neurological disease clinically. So usually the history is very important to us, the clinical examination. And you know that neurological examination is a very prolonged examination. When we want to examine a patient with Parkinson's disease, we have certain exam. If you want to examine a patient with neuromuscular disorder, you will go for such exam. If you want to examine the patient as a whole, you need to do the all deep neurological examination. But usually it's clinical-based specialty. The other thing, even more, when you want to do nerve conduction study and EMG, you need to interpret the nerve conduction study and EMG by yourself as physician. The other also for the EEG. If we did EEG for such patient, we need to read the EEG by ourselves. So it's mainly clinical skills based specialty. The other thing for satisfaction is about the clinical outcome. For example, if you have a patient with acute stroke presented to you in the ER with devastating neurological deficits, it's very dreading patient with dense hemiplegia with high INAT score, and you can save patient life and you can help him to have better clinical outcome. يعني ممكن يجيك البيشنت is completely bad with from neurological deficit، أو ممكن يخرج البيت يمشي على رجول بفضل الله، ثم بفضل الأدوية اللي ممكن احنا نقدمها. الشيء الثاني هو routine changes. Neurology is not like other specialty يعني just we have clinic and inpatient consultation and that's it. No, we have also EMG, we have nerve conduction study, we have procedure ممكن نحقن botox, LB. So we have variety and diversity also for the cases we see also. The availability of many ideas and point of researches. نقاط الأبحاث جدا كثيرة، نقاط المؤلفات اللي ممكن أنتم تقدموها as neurologist is very huge. and high chance for job availability. في احتياج لأطباء الأعصاب بشكل هائل في جميع مناطق المملكة. بالنسبة للديسادفانتج في كل تخصص في مميزات وفي عيوب أيضا. للأسف من الأشياء اللي ممكن احنا نعتبرها من الديسادفانتج حقت النيورولوجي الكلينيكال اسسمنت حقنا. usually as I mentioned that we usually depend on the clinical assessment for diagnosing most of the neurological disease clinically. So our assessment is very prolonged. Number two, also for assessment of the patient, we need to master how to read brain imaging like CT, MRI, CT perfusion, CT angiography, CT vinography. For most of the neuroradiology, we are the one who interpret the imaging, and some patient you might have interpretation from the radiologist, and one of the most devastating finding can be missed by the radiologist. So you are the one who can master how to read neuroimaging. For the in-calls بصراحة differ. Some in-calls can be passed very smoothly. You can see, for example, around 10, 9 consultations with no admission, but sometimes can be much heavy, and you can have end with 4 or 5 admissions. A lot of the ER, including the ER consultation, you can't discharge. But it's a variety. It's not like straightforward. And also it depends on the center that you work on. If you work in the high specialized center, you have like better and moderate can average lifestyle. But if you work, for example, in secondary hospital, the flow can be very high compared to the specialized center. The other thing also for the stroke code, when you are dealing with a patient with a stroke code, you need to be more faster. Your clinical assessment can be faster. You need to push the patient as soon as possible for the CT and for the in order to have better time consuming. The other thing, because also the TBA is different in the time. Each 1 minute you lost, you can lose more than 2 million of the neural cells. So you need to be more faster for clinical assessment. واحدة من الأشياء للأسف غالبا احنا النيورولوجي اللي تزعجنا أكثر الابيوز حق النيورولوجي سيرفيسز. You can end with the consultation more than 7 or 10 consultations from the ER. They call you that the patient has dizziness, and you consulting you just to rule out central cause. Most of the patients and most of the other specialty, they do not understand neurology very well. So they can call you that the patient has confusion, but when you went to assess the patient, you will find him aphasic. So you will announce a stroke code for such cases. That's why usually neurological symptoms or deficits can be very tricky, and not other specialty can detect it. This is one of the disadvantage. The other thing, some disease unfortunately has poor outcome, like for example, patient with ALS and such on. بالنسبة للايف ستايل during pregnancy بصراحة للأمانة هو يختلف من سنتر لسنتر، يختلف من ال type of the cases that you will face, it depends on the center that you work on, but in general it's like average. It's not like too much heavy, it's not too much low flow, it's considered as average. بالنسبة لللايف ستايل after residency, actually it's comfortable. بصراحة would depend on the specialty that you will pick after residency, like fellowship program. But in general, it's comfortable. It's not like heavy other, like compared to the other surgical specialty or like internal medicine. This is the fellowship that's available in the residency program. You can have stroke or vascular neurology. epilepsy, movement disorders, neuromuscular neurology, neurocritical, neurointervention, like dealing with a patient with large, for example, with MCA, and you can end with complete recanalization by neurointervention. Multiple sclerosis, neuroophthalmology. You can have also headache or neuropathic pain, cognitive disorders, and rehabilitation. This is most of the neurology fellowship program. We have established a program in Kingdom of Saudi Arabia, like stroke, epilepsy, MS. Just this year was well established, and also neurocritical as well. If anyone asks me, would you join the same specialty again if you went use back? Definitely yes. قبل ما أدخل النيورولوجي كان عندي شغف كبير جدا بالتخصص. بعد ما أخذت الإلكتيف في روتيشنز الشغف عندي الأمانة زاد، فعجبني التخصص as a specialty, as from the kind of cases, from thinking. Definitely yes, by 100%. شكرا جزيلا على حسن استماعكم. لو في عندكم أي أسئلة أو اقتراحات أو استفسارات عن التخصص, you are welcome to contact me anytime. This is my email and this is my phone number. Thank you very much.